And we'd really like to begin by acknowledging that we are in Mi'kma'ki, the traditional territory of the Mi'kmaq people, and to acknowledge that people of African descent have helped shape the history and culture of Nova Scotia for more than 400 years. I'm now pleased to introduce Interim President and CEO of Nova Scotia Health, Karen Oldfield, and Health and Wellness Deputy Minister, Jeannine Lagassé, who will provide an update on the work underway to improve the health system and answer your questions. With that, I will ask the Deputy to say a few words.
Thank you very much, Nancy, and thank you all for being here this evening. Originally, Health and Wellness Minister Michelle Thompson was going to be joining us tonight, but there was a change in the schedule of the House hours, the House of Assembly hours, and so she was required to be there tonight, as also MLA Dave Ritzie also would have joined us this evening as well, but they're both in the House of Assembly this evening. So I bring their greetings, and thank you to all for coming out this evening. Just wanted to acknowledge the staff at the back that have been here with us. As Nancy said, it was nice for there to be such a buzz in the room for people going through the various kiosks. And we hope you were able to get some information from them on topics that you wanted to connect with them on. We're here tonight. This is our second of sessions that we're holding throughout the province over the next 2 months. It'll take us all the way into December once we're finished going around to all the communities that we're attending at. We were in Windsor on Wednesday night. And we're really here to hopefully provide you with some information about where we're headed with some of the changes that we're making and initiatives that we're undertaking in healthcare, and to hear from you, to answer your questions, and to hear from you what is going on in your community and information that you would like to provide to us. We're here because we know that there are huge challenges in the system. Often we hear that people can't access primary care. They're waiting a long time for surgery. We know that we need more healthcare workers. So we know and acknowledge that there are real challenges in the system. Around this time last year, because it was in September of last year, CEO Oldfield, myself, Minister Thompson, the Premier, we toured around the province to hear from healthcare workers. And what we took all that feedback, and it helped us to form our Action for Health strategic plan for the system. And it's the first plan for the system for about 28 years. So it was quite a big event for us to be able to take that feedback, challenges, solutions, things that we should be doing, and put it into that plan. And that's really our guidepost now for and how we're implementing and the initiatives that we're undertaking. And really, one of the things we wanted to talk about tonight is that, we really need big change in the system. That, tinkering around the edges, small changes, doing more of the same that we've always done is not going to get us to the transformation that we really need. So we want to talk to you about that, and that it's really about being big ideas, bold ideas, trying things that we've never tried before, because we know as we've continually invested more money into the system, it hasn't gotten us better outcomes that we're looking for. So really need to talk about big change. And the other thing that we just wanted to talk about is that we feel that if not now, when? That we're really working hard. We feel that we've accomplished a lot over the last year, but there's a long way still to go. And so that's why we're here, hearing from community across the province, so that can help to inform where we take our next stages of planning. So thank you very much for being here this evening. And I think that Karen's going to say a few introductory comments as well.
Sure. Thank you, Jeannine. Hi, everybody. Thanks for coming. I think we have quite a few healthcare workers here, actually, present and retired. So maybe just a show of hands. I know all the folks in the back, but up front here too. I know that I know these three in the front row. Okay. Proudly they admit that. Okay, great. So this is great because we need your feedback. We need your help. You know what's going on the ground floor, and the more we can understand that, the quicker and the faster and the better we can fix the problem. I mean, we don't want to be sitting in offices thinking we know the problem when you know the problem. So I'm pleased to have you all here, and thanks for coming. And actually, I can assure you that the minister and Dave Ritzie both would prefer to be here tonight than being in the House, and they're there till 12 o'clock tonight. And they've been there till 12 o'clock every night this week, and they will be for the next foreseeable future. So when Jeannine says They're in the House of Assembly. They are. Anyway, so the reason, of course, for a Friday night is because our minister is from Antigonish. So on her way home, it would be, it's a good night for her to be able to come to Truro as she's leaving for her constituency. So anyway, thank you all for coming. And as I was saying to a couple of folks in the front row, I understand our main competition is the corn maze, which is underway now. I've never been myself, but guess what, Jeannine? I know. Yeah, I could totally understand why people are at the corn maze, especially on such a nice night. So, I have a lot of prepared remarks. I'm not really going to go into that. I'd rather just take a few minutes to just talk sort of off the top generally, and then we'll dive right into your questions. We had a very interesting night on Wednesday in Windsor. They have a wonderful community hospital. They don't have a regional hospital, but they have a wonderful community hospital, and it's a wonderful community. One of the things that Windsor experiences, and I believe you are experiencing here in Truro, certainly, Truro proper, and the surrounding area, is population growth. I spoke to the mayor of Stewiacke, and Pam, both of whom said Stewiacke's growing. I know from just reading the paper and the building that's going on in the town of Truro that it's that close to Halifax that it's a great, people can afford it. Or affordability is a factor, and so more people are moving to Truro or living in Truro and commuting into the city. So I don't know your exact numbers here, but I have to bet it's taking its toll on your infrastructure, which would include, of course, your hospital and clinics and the need a family practice list and the number of doctors and so on and so forth. So I'll be interested in feedback around that tonight and things that we should be thinking about. I also had a quick chat with 4 individuals who are members of the foundation, and I learned something. So I've already learned something tonight, which was that we may be over-processing how we interact with foundations, and we may not always be on the same page of where the foundation would like to go and what the health authority, where they would like to go. So I think we might be able to bridge that a little bit, so hopefully there will be some information that comes out about that too. I just finished by saying I had a really, again, quick but meaningful conversation with 3 former healthcare workers in the front row, and we were talking about the fact that things haven't really changed. Not in the past year, but let's take 20 years, 30 years, 40 years, they haven't changed. And Jeannine is right. This is the time. There is no reason we can't make the changes we have to make. There is no reason. And when I say that, what I mean specifically is that we were given more money, $413 million this year, and the entire health budget between NSH and the Department of Health and Wellness and related is $5.2 billion, okay? $5.2 billion. Now, payroll, wages, healthcare workers, of course, is a significant component, but it's not the money. It is not the money. We have to make the changes that are going to get us the better outcomes. We have to, we need to do smart things with the money. We need to, we can't be duplicating. We do see a lot of duplication across the system. We have to invest in technology. We have to invest in our people. We have to invest in our people. And actually, one person I want to recognize here too is Janet Hazelton. So I know Janet has some thoughts, and we need to hear them. We all need to hear them. I mean, she has some of the most important people in the province that she worries about every night, which are our nurses. And there is so many stresses and challenges. We talked, one of our recent conversations about losing young nurses to travel nursing. And, you know, I put myself in the shoes of a young person and I think, well, okay, maybe I would like to see the world for a little while, or see another province, or see another place. And if I could have my expenses paid and I can kind of pick and choose, and then I can have weekends off, I have some, you know, perks that I might not necessarily have if I was just working as a nurse in Nova Scotia. So we need to understand that, and then we have to try to meet people where they are. So there's so many challenges, and that, ladies and gentlemen, is why I love what I do. I am interim. I've been there since September 1 last year. We are literally working day and night, but we need to, because there's a lot that we have to do. But we can't do it alone. We're all in it together. And so I'm going to stop there, and maybe we'll go right to the questions.
Sounds great. Thank you very much. So we are going to move on to the questions and answers. And as I mentioned before, some were submitted ahead of time. And I have one from a participant that I will read. So I think what we'll do is I'll start with some of the pre-submitted questions, and then we'll kind of alternate to see if there are people in the group that want to ask their question. And so I'll read this one, and then I'll stand up and look around and see who has their hand up to ask a question. So the first one, it's interesting because we talked about it a little already. So the question is, what is being done for the people on the Need a Doctor list? How can we see where we stand on the list?
No, you start. Jeannine, we have this shtick. I need to catch my breath. You go.
Okay, fair enough. The Need a Family Practice Registry is here to stay in some form, but we just know that it's not working for people, and it's not working for us either. So what we're trying to do is to figure out how we make it more efficient, how we can get better information out to people who are on it, and how we can use the information that we gather when people register on it. So I think now people would hopefully know, and there's some people here from Virtual Care Nova Scotia, that for anyone who is on the Need a Family Practice Registry, that they do have access now to Virtual Care Nova Scotia. So that's one of the things that we have been able to use the registry for over the last year. But we know that there are many more things that we can do, that people who are on the registry don't necessarily all have the same needs, that there may be people who have higher needs who are on the list, and other people who have been on the list have lower needs. And so we need to figure out how we can do a better job of looking at the list, triaging that, connecting people with the right providers, and making sure that we're providing the best service to people. So I think that short, we want the list to work better for you and for us.
So let me just add a couple of thoughts there. And as Jeannine said, so we do have the Virtual Care Nova Scotia folks here. So if anybody wants more information or wants to help signing up and so forth, we do have a team here that can help. It's really interesting how it works. So we didn't have anything before the pandemic. There was, you know, like certain physicians might do something by Zoom or Teams, but there was no such thing as Virtual Care Nova Scotia. But we realized very quickly, or it was realized very quickly at the onset of the pandemic, that we got to do something, or people are going to be losing touch with their providers. So literally, that Virtual Care Nova Scotia started in May of 2021. 16 months ago, 17 months ago. It's not old, it's new. And in that relatively short period of time, it's now available to anybody who is on the Need a Family Practice list, which, as we know, is upwards of 110,000 now. So anybody who's on the list can access care through virtual care, Nova Scotia. And one of three things will happen. You could be referred to be seen in person, and that would happen at a primary care clinic, which you have here in Truro. So you would be referred there, and you would be seen there. You could be referred to a specialist, or the provider who is seeing you may be able to handle the issue on the spot. So, interestingly enough, one of the questions in Windsor the other night was the exact opposite of that. I have a physician, I have a provider, but I still want to go on. I want to use virtual care in Nova Scotia. I want to do it. So, and I personally would like to be able to do it for the odd refill or something simple. It would just save so much trouble. So I just give you my own example, and then I'll come back to virtual care. 2 weeks ago, I needed antibiotics, and I knew I was not going to get in to see my doctor probably for 2 weeks. So I decided I was going to try Maple. And so Maple is a product that you have to pay to use. You have to sign up, you have to pay. Mine was during the week. It was $69. So I signed up. I saw a nurse practitioner, and it was not visual. It was just all chat. So I dealt with the nurse practitioner, who was a person from Ontario, licensed to practice in Nova Scotia, and I got my prescription. The prescription was emailed to my pharmacy. I got confirmation. I called the pharmacy in an hour. They already had it ready. So I didn't even leave my office, and I was able to do this. So for me, for that example, it was just like, oh, I need to be able to do this more regularly, which is when I concluded, I want to do this too. So the long and the short of it is that we are going to scale virtual care in Nova Scotia completely across the province to anybody who wants to use it. It will be free. The one I used was not virtual care in Nova Scotia. It was Maple, which is a pay product, but ours will be publicly available. It will be free, and it will take time. We just went from May of 2021, so now we are able to handle 110,000 people. And the only barrier to doing it tomorrow is that we have to have the providers. We need to have the nurse practitioners, the physicians, and so forth. And so I look at these numbers every day. Like I follow our virtual care numbers every day because I want to see if people are able to, if there are any challenges or problems. So it is not a full solution. I'm not saying it is, but it sure is helpful. And it is one way that people are being able to access. And if they do need to see someone in person, they are able to go and access that through the primary care clinic. The long answer to the question.
Thank you. I'm going to read another one that was submitted, and then I'll go to the group. So this question is around long-term care placement. So my mother was assessed an L2 and was denied urgent placement because we did not access community services. I've looked after her, and when I needed the help, I was told no. So why am I being penalized for this?
This is a good question. And I don't think I have the answer to it. I wouldn't say penalized, but certainly something that would require some digging into. I honestly don't know the answer to the question. If the person's here, I'll be happy to speak to you separately. And we do have a group. I think we've got some continuing care folks who may be able to help. So perhaps after, if you would like to just have a word, we can see if we can't help.
Thank you. Okay. So now I'm going to stand up and just take a look around. Is there anyone that has, I have a list of questions that were submitted that I can certainly address.
You don't have to be shy, guys. Like,
Yeah.
it's Friday night. Come on.
Okay.
We're like, I got a sweater on. I mean, we're at ease.
Yeah,
So
absolutely.
please.
Like, I watched
This is a conversation. Yeah.
Yeah, Wednesday night was a true indication of that. It was really great. So yeah, ask the questions and we've got one person in the back and then
Come on.
up here.
That's right.
After. Yeah.
We may not know every answer, but we're going to do our best.
So I would just like to understand the difference. So is virtual care and the Maple app the same thing?
No.
No. Okay. So I just have a scenario. This happened to me a couple weeks ago. I have no family doctor. So I had a urinary tract infection, or what I thought was one. So I went on to my Maple app because it worked for me great in the past. I went on first thing, and it said that it's either full to capacity or it's closed for the day. So I was like, oh, that's weird. Maybe something's wrong. So I closed my phone down, opened it back up. Nope, same thing again. So then I thought, okay, what do I do? So I have no family doctor. I'm not going to sit and emerge for a long period of time. So I went to the walk-in clinic at the pharmacist I live in the town of Glasgow, and they said, no, they're filled up for the day as well. They can't see me. And I said, but go downstairs to our pharmacist and they'll see you. So I went downstairs and there was only one pharmacist on all these pharmacy assistants. And she said, no, I can't see you. I can't talk with you. I'm too busy. I'm the only pharmacist here today. You'll have to go to another pharmacy. So I went to my own pharmacist, and she was the only pharmacist on. They were short-staffed. And she said, I will not be able to see you because I'm too busy giving COVID shots all day. We're closing early because we're short-staffed. I'm going to be closing at 5 today. I may be able to take your number and call you back at 5 o'clock. And I said, well, that doesn't help me. I'll go to another pharmacy. So I went to another pharmacy in New Glasgow. And by that time, being a healthcare worker, I knew what I had. I was very upset. And I said, like, this is ridiculous. I know I just need a prescription. Why can't somebody see me? Because all these pharmacists were giving COVID shots. And you couldn't, the Maple app was no good to me. It was closed. So then my husband works for Sobe, so then I went on Dialogue. But it took me over 2 hours to finally talk to somebody. So I don't understand how come if this virtual care is offered, or Maple, how come it's not working or closed for a day?
So just so I understand.
Yeah, for sure.
Was it Maple, the same one that I used, or was it Virtual Care NS?
It's the little Maple app on your phone that you download if you don't have a family doctor,
So
and you can
that's virtual
download
care.
it.
KRNS.
Yeah.
Yeah.
That's
Did I
Virtual
pay?
Care.
That's the difference.
Yeah.
No, I didn't pay. Was I supposed to pay?
No.
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 I'm just a little
so,
bit.
So let's talk about that, because this is one of the issues, not just the fact that you couldn't get on that day, but who the heck's out there providing virtual care? Let's just talk about that for a minute. It's very important. Yeah. So Jeannine's the regulator, so she's going to start.
So I think that what we would say is that, if you need to go, if you were on the Need a Family Practice Registry, you should sign up for Virtual Care NS, because then you know that that is the service that Nova Scotia Health is providing. There are a number of private clinics and things that are out there that are operating now, we know, but we do not regulate them. We do not know. So you need to be really careful about where you are accessing private services. That Virtual Care NS is run through Nova Scotia Health, and that is one that we have oversight over. So I would say that. In response to the rest of the question, I think that it really exemplifies how short we are on some providers too, right? For you to go to all those different pharmacies and for people to say, I'm the only one here, or I can't do. So I think it just shows us too how important our recruitment efforts are across the entire system, right?
It is weird though, because typically you wouldn't get that response when you do virtual care, and we do have some virtual care people here. So I don't know if you want to speak to them separately. Like for example, I had an email complaint several weeks ago, similar situation, and so we put one of the virtual care teams in touch with that individual, and it was a computer issue that they had. So So, technology's great when it's great, and it sure is frustrating when it doesn't work. So I just want to make sure, so you might just have a word with the
Sure,
team there.
yeah.
But, so contrast my not leaving my office and bang, 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 bang with your experience, which was not a good day.
No, and it's just that, so pharmacists are kind of being pulled into COVID vaccines injections when before they weren't doing that task, so they could offer those other services to the public to treat them for UTIs, common illnesses that they can treat you for, but now they can't because they're so busy with COVID vaccines, and now it's going to be influenza. So I just, what's going to be offered for the public if the pharmacists are taking on more roles? That was
Well,
kind of
that's an
yeah.
excellent point.
Yeah.
And frankly,
So.
as we're looking at
Thank you.
pharmacy and pharmacists and and ensuring that we're maximizing their scope of practice, there would be more things. So, we have to be mindful. So that's a great point and really appreciate it. Thank you.
Thank you. We have another question up here. We'll get the mic up. Oh,
Just to
and
kind
from
of
the front.
follow up on what she was saying, we had a wonderful clinic here with nurses giving, I'm a retired nurse, and all three of us here gave vaccines. The clinic ran very, very well. All the patients that came for vaccines were extremely pleased with how things went and the way they were looked after. The last time I was working at a clinic, it got started up and then suddenly shut down within a week, and no one really understood why. But it seems to me that nurses are the best people to be giving vaccines at this time and leaving pharmacists to what they do best.
Will you come back to work if we set that clinic up again? Okay, good. There's a few things in what you say, so let's maybe talk. Let's address why did that clinic start and close. So we can certainly answer that. Jeannine can answer that. As I now know that there are a number of retired nurses in this room, you're hearing it from me. Like anything you want to do, we want to help you do. So if you want to do a few hours, if you want to, we have jobs for you. We have work for you, and I would love to have you. So just so you know, do not walk out of this room thinking that that I would not love to have you spending some time with the NSH doing something, and your friends, and theirs. So we want every nurse we can possibly find. And it's an excellent point on the COVID shots. I really worry about COVID this fall. I personally am worried about it. I have no reason for saying that other than everything I read, but I just think we're not in a spot where we can easily handle another Omicron. It would be very, very tough on our system, because what we're seeing right now is people who have finally started to come out of their home to seek care are coming out of their home. They're going to the ED because either they can't get in to see their doctor or their particular situation requires significant attention. So just as a statistic, we do know that 80% of patients, 80% of people who are coming to the ERs across the province, they have a family doctor. They are attached. So, it's not the case that it is unattached people going to the ERs. It's the reverse. So we actually, what I talked about earlier in terms of we had the virtual care, they can access a primary care clinic, they can be seen. We have places in the province where people say, you know what, I want to go on the list so that I can get into a primary care clinic faster than I can see my own doctor. So this is a problem. Anyway, do you want to just touch on the COVID clinics and why that might have happened, Jeannine?
Yeah, so I can't speak to this, I don't know the circumstances of your particular clinic, But I think, throughout, we've had to weigh, a number of different factors. And one of them being access throughout the province, right? And being able to have, so the pharmacy network has been very good for that. We've been able to provide access to people close to home, different options. So that's one of the reasons why the pharmacy network has been used throughout. The other issue has been at various times, because we know that we do need more workers, that there have been circumstances, and I understand that you're retired nurses, and so maybe we could chat a bit more about kind of your particular clinic situation, but it does take an incredible amount of person power to have those clinics set up. And we have at times needed those people back working in their home facilities and in their home positions. So that's why some of the network of the specific clinics has been stood down, and that the pharmacy network continued. But I'd be interested to know kind of more about your particular clinic and the circumstances of it.
Thank you. So we have a question in the front. You ready? Yeah, right.
I had a couple of questions, but this one is not pertaining to me. I have an 86-year-old neighbor who I do break-in wellness checks on her, actually. The daughter will call and say, I can't reach Mom. She's not answering her phone. Would you please go over? So I have the key to the house, and I walk in and find her in the bedroom. And she's deaf. She usually doesn't hear me. I'm always afraid of startling her, but she receives me quite nicely. Today, I got a call, could you check on Mom? She's not answering her phone. She wasn't feeling well yesterday. So I go over, and she is in bed. She has a very high temperature. She's not well at all. So, being an old retired nurse, I take her temperature. It's 102. She's 86 years old. She tells me she also has a urinary tract infection that she's being prescribed medication for. Da-da-da-da-da. Anyway, in my assessment, I decide that she's not very well. I gave her Tylenol just to see if the temperature would come down, and it actually didn't. Within 4-hour period, it was up to 103 now. So I said to the family, who are the family members, her daughter and son-in-law are there now, and I said, I think it would be prudent to call 811. Your mom is dry. She's not drinking much, just a sip here and there. She was up, they reported that she had been up to the bathroom once with them while I had been removed myself from the house for a bit to go get a blood pressure machine. So I call 811. And the result was that it would be that I would speak to 811 and report what's going on with Mom, their mom. But no, I can't. It will be 2 hours before the nurse will call. So, plan B. So I leave the information that I've collected on Sue for them to receive the call when the nurse calls 2 hours later. I guess I thought when you called 811, you got to speak to a nurse. I haven't heard from the daughter. She was going to report to me when they called her. I just checked my phone. There's nothing there yet. And we're into the third or going to the 4th hour now. So I'm not sure what happened there. Another quick question I did want to ask, just out of curiosity, why the physicians, and remember, I'm an old nurse and I've been a long time around the clock here, but I was 5 years without a family physician, so I understand in 5 years a lot can change. I have a lovely new doctor. But why do primary doctors not do primary care anymore? They don't take blood pressures. They don't feel your pulse. They don't do a lung check. They don't weigh you. They don't do a mental health check-in. And they ask me, what do you need? Which I just find that's a bit odd. And I can feel through that, but there's lots of seniors, and maybe young people can't either, but there's lots of seniors who couldn't. They would just go in and say, oh, I'm fine. I'm just here to, I don't know, get a prescription filled. So that's just a query. I don't expect you people to answer that. I understand that you're not producing doctors, but I just find that a bit strange.
So you got a lot going on there. For a retired nurse, you've got a lot going on, and I thank you for your contribution to your community. Your neighbor's very lucky to have you, very lucky. So on the 811, that's a department issue, which we're grappling with. So maybe you could
Totally,
take
yeah.
that.
Same as everywhere. It's not a great answer, but there are capacity issues, right? That there are times when their call volume outstrips the number of providers that we have available for calls at the time. So that's an unfortunate situation for sure. I will take it back because we do have regular statistics about kind of wait time, number of calls fielded, all those things. So I will take it back and see if there was something in particular that was going on today that may have caused that to happen. But unfortunately, there is sometimes a wait time, yes.
Do you want to comment, maybe Jeannine, as well, on scripting of 811 and additional training of the folks within the 811 setup? And the reason why I say that, I thought where you were going with your question, I thought you were going to say, and you got in touch with the 811 nurse, and at the end of the conversation, we're told you had to go to the ER. Because that is something that we get very regularly, okay? So what am I doing? I could have just gone to the ER in the first place. So do you want to just maybe comment on that, Jeannine?
So again, that's one of the things that we're looking into in all of our overall work, right? Is what is the service provided by 811 and how does it fit into the broader system and the broader places where people can go to access care? So I think, again, we've been reviewing the statistics, the type of calls that people get, the number of calls that end up in referral to the emergency department, so that we can determine whether or not the service is providing as we expect it to for its segment of what we want it to do, right? Because if everybody's just being ultimately referred, that's not the purpose of the service, right? But I think that there are, I think that the statistics would bear out that that's not the majority of circumstances that they are referred, but just so that you know, we are taking a fulsome look at the service and where we can integrate it better, differently as we do the primary care work.
Thank you. I'm going to read one of the other submitted questions. So this question is, what structures and processes are being put in place to ensure the voice of the patient and family is included in the planned healthcare changes?
That's my friend Brenda. Yes, it is. And luckily we had an opportunity to chit-chat about it earlier. So do you want to add to that, Brenda? Would you like the mic to just sort of...
No, I have a loud enough voice. And I guess my concern is truly engagement. We talked about being patient-centered. I have absolutely no doubt that every provider in this province thinks about their patients. What I'm talking about is engaging patients and their families in a way that's being different than we have seen in the past. It's not consulting them. It's not giving lip service to a true partnership, but in fact, it is working with patients, giving them a say, and holding them accountable, or giving them a role and responsibility in their care. In a time when we're faced with significant human resource challenges, we're forgetting to look at the patient and the family and their role in their care journey. Thank you.
Thank you. Thank you. So I just want to maybe make a couple of points with respect to that. I mean, you're right on the money, for sure. So 2 or 3 points. Number one, I do want to share something. It's a little bit outside of, it's a little premature, but I'm going to share it anyways because it's one perspective. And then I would like to also talk to the broader issue of engaging patient and family in their own care. What I would wanted to start with was many of the healthcare workers in this room were involved this week in our accreditation process. So retirees will know what that means. And a lot of the folks, certainly at the tables, have been busy doing their job this week, doing their job tonight and also helping out with our accreditation. So that's basically the certification of our hospital system. And interestingly enough, in many provinces, it would just be a site, a hospital. But because we have one health authority, when they come to do accreditation in Nova Scotia, it's the entire province. And it's a lot. So there were over 30 surveyors looking at our system, top to bottom. So the first thing I want to say is thank you to those in the room who were involved in that process, because it's kind of scary. People are looking at what you're doing, asking you what you're doing, making sure everything is just so. And so this afternoon, we had a little debrief as to, you know, what was found, and for the most part, it was extremely positive. This time, so that you do it every 5 years, the last time was in 2017, and this time there was a patient and family surveyor. Like, we had a whole stream that was looking at our interactions with patients and family members, and looking at whether the health system really is as patient-centered as we say we are. So just the quick feedback, which I thought was really good. You know, the surveyors said that that was clearly a value in our system, that the providers across this province, as Brenda just said, were very patient-centered, and they could see that from top to bottom, and they thought that was a real plus and one of our the true values of our system. So that's a good thing. Now, in terms of the engagement, they also said that there were some gaps, and you know, you kind of put your finger right on one. And frankly, we have to find ways where people and families can take charge of their own health. So that's pretty much everything from soup to nuts. I mean, that is, there's so many aspects that go into that. You know, our social determinants of health, there's many, many things. So when Jeannine talks about transformation, that has to be a big part of it. We haven't really we have lots of data. We have lots of data on that. We know the demographics, like we know where the challenges are. It's attacking the problem with being able to actually achieve outcomes that's going to be hard. So the minister, Jeannine and myself, had a learning opportunity at the end of June. The minister was invited by the Danish government to go to Denmark to observe their system, and the minister was allowed to bring 2 people. So Jeannine was person 1 and Karen was person 2, and we learned so much. And this is one of the things that Scandinavian countries, and in particular where we're only in one city in Copenhagen, but you know, how they handle and bridge that gap with patient and family, and the ways that they have found to have the patient be very much part of their journey. We learned quite a bit. So they definitely do a better job. So for example, one of the things they do there, you'll love this, Mr. Mayor and councillors, when a person is discharged from hospital, they how did it work there, Jeannine? So they basically, it's the municipality which takes that person from hospital back into their home. I'm talking about an older person who here would be waiting for a nursing home bed there, because they put a lot of energy, time, and effort into home care and staying at home. The municipality manages all of that. Would be the person that goes to check on the neighbor, like manages all of that. And I just couldn't even dream of how that could ever work in Nova Scotia. Mayor Savage, it's Karen here. We have a few patients that we'd like to, you get to take a few people home today. I mean, I just can't see that happening. But that's what they do, and that's how it's managed. And so they really, and they have a program that they're on it all the time. So that's just one small thing that we learned, but your point's a very good one. I don't know if you want to make any additions, Jeannine.
Yeah, I think I would just add that we need to get better at all engagement. And so I think patient and family is one aspect. We are working in the department, we've created a division, an equity and engagement division, because we know that we need to be better going out into community and really meaningfully engaging with community, hearing what they need, taking what they're creating and working with that in the system. So I'd say that it's all areas of engagement where we could improve, but that we have put resources to it. We're working cooperatively, department, NSH, IWK, in regard to creation of the health equity framework. And a lot of that will result from that engagement that we go out into community and hear back from people. So I think thank you for raising it, because it's important to us, but we know that we have a long way to go to be really meaningful in the engagement that we're doing.
Thank you. Oh, we have another question down here.
I just wondered if there's any thought to the future and starting preventative medicine. So it won't solve the acute problem right now, but looking to the future, more health initiatives in schools, and I don't know how that would even unfold, but we are, especially Nova Scotians, generally an unhealthy population, and that costs a lot.
Yeah. So sorry.
That's okay, I'm done. I think preventative health is really important.
I just get so excited when I get to talk about Action for Health. Because I was going to say, really, Solution 6 in Action for Health is really all about wellness, right? So that's what I was going to say, and the actions that we're going to take toward that. And again, one of the big pieces of that is community wellness framework. And a lot of it comes from, and it's the engagement piece as well, right? But Solution 6 is all about prevention, promotion, and general wellness of our communities. So very big focus will be put on that. So I know our public health folks working with others, just again across the system, but kind of led mostly on the public health side, we'll be working on Solution 6.
I'd like to add to that, because Monday mornings, the deputies of all of the departments in the province meet, and they go through their list of what's important in this, that, and the other thing. And this week, Jeannine and I were invited to present on health and what we're doing and the different things that we're doing. I raise it because you mentioned what we're doing in the schools. And I know this is shocking, but one department doesn't necessarily know what the other department is doing. And that makes me crazy, because we should know across systems. And so the reason we were asked to do this is because healthcare is the #1 priority of this government. And this government is requiring all departments to see how they can support the initiative. So that would include Department of Education as one example. That would include Department of Community Services. So one of the things that came out of that meeting on Monday, just, I think we spoke for maybe an hour and a half. The Deputy Minister of Community Services shared a pilot project that they are doing, and they have 250 persons with disabilities who are clients of the Department of Community Services, and they've got a partnership with Canada Post. 250 persons are working with Canada Post, earning money to pay for certain things that they need in their lives. So she says to me, Karen, maybe we can do a partnership. You need people. And I said, that's smart. So that's super smart. We need people all across the province, and what we would have to do is match skill set to role, but we can do that, and it's possible that we could have a win-win-win. What a great win for the person, what a great win for us, and great win for the province. So that kind of cross-government thinking is really important. I mean, that might sound dumb, but it's actually smart and something that hasn't been, we just haven't done it before. So an example, and I appreciate your raising that.
Thank you. Sorry. I was just going to take another one from our pre-submitted, and then I'll go back to the audience again, so we can, and I guess the other thing to say that we will try to get through as many questions as we can tonight. But if I've learned anything from the last conversations, is that all of the questions in some way, shape, or form will be answered. So, so this question is about respite beds, and it's wondering, when will there be more respite beds open in Truro area to give caregivers a break, and will there be more beds made available for long-term care?
We're both flipping to our notes on this one because we wanted to be prepared for this one. We had asked our colleagues at Seniors and Long-Term Care for a bit of information about this. So I do know that some of the respite beds here in Colchester were moved to regular admissions to help us with being able to get more people admitted into. But as I understand it, currently there's one. I think, is that right, Karen? In Colchester, there's one in Cumberland, and there's one in Pictou, is the current amount. So we know not ideal at all for the situation, but really that the beds are the number is down because they were being used for regular admissions.
Yes, that's what our stats say, and that seems woefully inadequate. Mm-hmm. However, on the long-term care part of the question, so at the moment, the folks at the Department of Seniors and Long-Term Care are busy, having announced 27 builds, so new homes, and I think that will take us to 2,500 beds. I think 2,500 beds. I like to step back and maybe talk about all of these beds for a minute. One of our biggest challenges, and maybe this is not news to you, but certainly bears repeating, we're having real trouble getting people in and a lot of trouble getting them out. So basically, the system is jammed at both ends. It's jammed. So what I mean by that is, we have long waits in the ER. Part of that is because of staffing, and part of that is because we do not have beds to admit patients to. We don't have beds to admit patients to because we have a great number of persons in our hospitals across the province who need another kind of care, which is not a hospital. It could be long-term care, it could be home care, it could be some form of transition care, but it is not acute care. So the last number I looked at, I think, was 271, I think, is where what I recall. So you think about that. So these nursing homes, and this is not unique just to Nova Scotia, but it really is pressing here. We need those long-term care beds. So again, we would work with our colleague, the Deputy of Seniors and Long-Term Care, to help us try to get our flow going a little bit more. But nothing is the substitute for an actual bed. So we need those builds. We need it done. We need it done now. So he's on it. There will be, as I say, 27 new builds. And part of what comes out of that, in fact, is, I know 3 in particular, one in Meteghan. This has nothing to do with Colchester, but one in Meteghan, one in Mahone Bay, and one in Liverpool too, where there will be new homes that, and we are going to be able to take over the existing nursing homes that we will be able to use for beds for us. So for those people who don't need to be in the hospital, be a different level of care. So one of the things we're looking at in across the province is increasing the use of transition beds. And so, you know, we if we look at COVID, just looking at Halifax specifically, like 100 beds at Northwood were closed, and they were closed because people were sharing rooms. And we learned through COVID that's not, you know, that's not what we want to be doing. But that's 100 beds out of the system that we have to replace. We do need transition care beds, and I would just say stay tuned, because I think the government will be looking at making some more announcements around that shortly. But that is really a problem for us, is we can't, you know, we think about the whole respite matter and so important, and sometimes what we've seen happen especially over the last 2 years, people are just at their wits' end. People are at their wits' end. They're very frustrated with, you know, everything that's going on and all of the challenges that they have. So we've had situations where people are dropping their loved ones off at the ER and walking away because they're at their wits' end. And, you know, that's awful for the person who is dropped off, awful for the family who leaves them, and very tough for healthcare workers who don't really, you know, of course, the person will be coming into the hospital, but we have to find a place for them. So it's really sad. Anyway, we're well aware of it, and on the beds, as I say, 27 builds coming soon.
Thank you. We'll go back to we have a question up at the front. Oh, sorry, in the back first, and then we'll get you second.
Oh, okay.
Thank you. Go ahead.
Oh, I didn't know which direction you were pointing. I guess my concern, well, with a lot of health, but I'm deeply concerned about mental health, especially, well, all mental health, but especially acute mental health. You talk about families being involved, and we've come a ways, but it just fluctuates. It's good, and then it's awful, and then it's not too bad, and then it's awful. And I am a family facilitator with Family Matters in Mental Health. I'm not sure if you're aware of the program, but it's sponsored by Nova Scotia Health. It's now done through, I want to say Schizophrenia Association, but it's another name now. And even that is hard because we're not getting trained people, and the same people we trained probably, I don't know what it was, 8 years ago. So there's the same ones doing it all the time, which I love to do it, but you can't do it twice a year and still keep your mind going because you're trying to look after your loved one. So I guess, I don't know, truthfully, I'm not sure what the answer is. I do know you talk about also trying to get meds and things, and I know with my own case, circumstances where he doesn't really have a family doctor because because of his acute mental health, doesn't really want to go to a family doctor, so he goes to a psychiatrist. But when the psychiatrist goes on vacation and you don't know, and the medications do, and I'm scrambling basically all over the place trying to get the medication because they will do a couple of them, but if it's a controlled substance, nobody wants to fill the prescription. And as we all know, for acute mental health, they need to be on their medication. You know, if they want to take it, for God's sakes, give it to them. I mean, it's not the whole cure, but it definitely protects families, it protects everybody, the public. I mean, and they're not monsters, they're just people that need something. You know, it's like anything else. You don't take the proper medication, you're going to have a heart attack. So, I mean, it's just the same with mental health. So I guess I have a whole lot of issues about it, but I really think they need to include families because we go in this circle, we don't know what happens, and if they would just call us for 2 seconds to answer our question, maybe it would save a month, maybe it would save 3 weeks of being totally out of your mind trying to figure out how you're going to do something. So I just think the isolation of it all it's hard for all of us here, no matter what's wrong, but I am concerned about mental health in Nova Scotia.
thank you for the comments. Yeah, I agree. I would clap too. It's, I worry about it. I think we haven't even scratched the surface yet in terms of what could be coming out of COVID, especially for young people. I really worry about it. Kids who, young, medium, teens. We don't know. We don't even know what has happened in the last 2 years. So I know there are a number of mental health folks here. I don't know if anybody wants to tackle that question or not. I feel woefully inadequate to, say too much about it. We do have the Office of Addictions and Mental Health now. We do have a minister who's very focused on this, and we have. We were lucky in Windsor. We did actually have the psychiatrist we had a psychiatrist who's involved in the programming there with us, but unfortunately he's not here tonight. So, but the issue that you raise of families being involved has specifically come to the attention of Minister Comer and Minister Thompson, and I know that it has because I was in the meeting when the individuals presented. And so, and the issue hasn't gone away because I received a recent email from the same individual. So it's important. And in that particular case, just being unable to ask questions because they aren't the patient and didn't have the consent to be involved in the file. So this is a huge issue because the very person who can see what's happening is not allowed to know what's happening medically. And so I'm not really sure what the answer is going to be there, but I will just assure you that it is it's on their desks, and we will need to come up with some sort of a solution if we can.
I also think that most of us try to deal with mental health and we try to deal with mental health and addiction, but we're also dealing with community services. And if one is not a quagmire, then the other one certainly is. I mean, to try to connect the two of them, you just want to put your head in I don't know where.
I could give you a few suggestions. I understand. Look, I get it. Okay, we do get it, and it's very difficult, and it's just finding the solution that's the hard part. So I don't know, Bethany, do you have anything you want to add to that?
I think we've connected.
Do you get the microphone?
Other way down.
This is Bethany McCormick, and Bethany McCormick is the Vice President of Operations for Nova Scotia Health for the Northern Zone. And she has had a heck of a week, and she also had Katrina and all those other things to worry about too. So thanks for coming tonight, Bethany.
Oh, no problem. Good evening, everyone.
Oh, Fiona. Why did I say Katrina? Sorry. I knew it was a name. Yes. Thank you. Thanks.
I'll just make it a little bit easier for folks to see me. I'm also the Vice President for the Mental Health and Addictions Program for the province. So I know that our teams are working really hard to try and match services to clients as we need them, and the involvement of family is very important. And navigating the confidentiality and the family and clients' wishes is always very complex. But we are working through that, as Karen has mentioned. And I'll just mention, the mental health crisis line and our intake lines are there to try and match folks to the right service at the right time. And we know we have more work to do. So if you have a specific question or case that we can help you with, the ladies at the back would be happy to chat with you.
Scott Armstrong.
Okay.
Well, first of all, thank you very much for coming and putting this on. It's great to see you and to be able to ask these questions. You mentioned, Karen, about the mental health effect on young people due to the pandemic. I'm a high school principal, and I can tell you the biggest impact and change in schools in the last 5 years, particularly during and after the pandemic, is the mental health of our students. COVID doesn't really, for the most part, affect students' illness as great as it does older people. But boy, does it ever affect their houses, because the economic impacts of loss of jobs and loss of employment by their parents forces a lot of them to miss school to take part-time jobs and go to work now. So they're actually working during school hours and missing school. It causes massive mental health issues for young people. It's just unbelievable. We also lost Northern Pulp, and I'm a rural high school principal. A lot of our parents lost their jobs when Northern Pulp shut down because they're connected to the forestry industry. So it was like kind of a double whammy here in northern Nova Scotia, which impacted us more severely than other parts of the province. So the students are struggling, and we did in our school, thankfully, have support from healthcare in terms of mental health practitioners right based in the school. They serve several schools. But what a resource to have in a building. So I encourage you to continue to partner with schools, have FTEs right in the buildings, right next door. If the kid's going through crisis, there's a family's in crisis, we have a resource right there we can connect to, because I'm not a psychiatrist. I don't have those skills myself, neither do my staff. But I tell you, it was a big advantage to have that. So thank you for that. The question I have, though, is on nurse practitioners. And I'm not sure. I know their scope has expanded. Could you maybe expand on how what they do now differently than what they did before? And how are they allocated around the province? Because there seems to be a discrepancy of where they are in the province.
Do you want to answer that, Janet? Do you want to start? How about you give your side or your info, and I'll jump in too. I mean, this is topical. Thanks, Scott. Go for it.
So nurse practitioners now can admit to hospital. They can care for someone while they're in hospital. They can discharge from hospital. They can write all prescriptions, including narcotics. So they are primary care practitioners. So the two pilots, one at Lawton's here and one at Lawton's in New Glasgow, those are run by nurse practitioners. And I met someone at a wedding in Truro a couple of weeks ago, and she had Lyme disease, and she was completely looked after by the nurse practitioner here, who called her, who looked after her, who got her in the right place for medications. And so nurse practitioner scope has increased, and they are autonomous and independent. Now they can consult and they can prescribe anything, but they can also refer to specialists. So if you need to see a cardiologist, if you need to, their scope has expanded 10 times. And what can't they do? In relation to a GP? Yeah. Nothing. Nothing. There is no, I'm not saying they're the same practitioners, but there is not anything that they cannot do. Can they build their own caseload of patients? Oh, they have their own caseload of patients. 800. They all have their own, they have their own caseload. They manage their own caseload. They consult if they find that they're, but that's the same as a GP. If a GP feels that they need to consult someone, they can, and so do the nurse practitioners. But they have their own, and now they're in Emerge. They're in all our units, so they're in hospitals as well. They can put chest tubes in, it's incredible what nurse practitioners. And now we have RNs that can prescribe. So we're just starting RN prescribing in some of our units, where in Emerge, if you come with a strep throat, you're going to be able to get an antibiotic from a registered nurse, not necessarily a nurse practitioner, which is another initiative that's going to help our healthcare system. Making and increasing the role of everybody helping our system, and and our nurses really like to see these changes, because it makes they're not having people wait 8 hours to get an antibiotic for a urinary tract infection. They're going to be able to do that themselves. And I think December is the first 4 grads from the RN prescribing will start actually doing it December of this year, with 52 entering in January.
Yeah, thanks, Janet.
Thank you, Janet.
Thank you. Jeannine wants to comment.
Yeah, they're all health authority employees. All the nurse practitioners in this province are nurse, and we still have to discuss salary.
Well, we'll come back to that. But you'll appreciate this, Janet. You will appreciate this. Again, going back to Windsor, we had a person in the audience who, well, number one, she said, "I'm just telling you straight up, I'm an ardent feminist, and my question is, why are nurse practitioners not paid the same as a doctor?" So I said, that's a much bigger question than Wednesday night. Not that I disagreed. So I just want to comment a couple of things on the nurse practitioners. It's so amazing. I'd say this time last year, they were not viewed in quite the same way that they are. I'm gonna say this. They were not viewed with having as much value across the system as what they are today. I think part of it's education, part of it's just, we're learning, they're advocating. It's fantastic, and I'll give you an example. We had one of our colleagues, I was at a barbecue in August, and friend's daughter, nurse practitioner, couldn't get a job. So colleague comes to work, says, Karen, how can this be? I thought you were hiring nurse practitioners. So I said, we are. Well, why doesn't this young person have a job? And I said, well, I don't know. Get the CV, get me all the information. We took care of that person. The person had a job the next day. But what I did was I went on my little LinkedIn. I don't do social media, but I do have a LinkedIn where mostly I give good things that are happening in our healthcare system. And I put out a notice and I said, we are actively hiring nurse practitioners. If you are one and you want to work, if you know of one who wants to work, have them contact me. So the last time I looked, the post had 27,000 views, and Karen got 50 names from that one little notification. Now, I personally thought that was amazing. Okay, I was loving that. And so what happened? We have that list, and we're going down that list, and we're finding places for every single one of those nurse practitioners. So, it's not an easy program. It's very, very difficult. It's almost harder to get into a nurse practitioner than it is to get into the medical school, and I'm not kidding. So when Janet says they know what they're doing, they know what they're doing. They can have a panel of 800 people, and we're going to be doing, I think Gail told me that the very first fully autonomous nurse practitioner is being set up. I can't remember where, she did tell me, and running. So a fully autonomous nurse practitioner, you go. I can't say girl because I don't know if it's male or female. In any event, so I'll just share that. I think we have right now 128 in the province, Scott, as I recall, and I want more and we need more. So,
How are they allocated?
well,
How come Pictou County has this many and Colchester has half as many or whatever it is?
a lot of it would be, so Scott's question was, how are they allocated? And it depends. It depends on what they would be doing. It depends on the kind of, what do they want? What do they want to do? Somebody might want to work in ER. Somebody might want to work, in a different line. So, and also, some of them, I've dealt with a person recently who specifically wanted to work in an ER in Queens. So it depends. In terms of allocation, though, I think what we have been trying to do certainly is work to allocate in the parts of the province where the need for a family practice provider is greatest. Go ahead, Jeannine.
If you don't mind, I just would like to comment a bit on your, speak a bit about your comment on the services that are provided in schools as well, because those programs are very important to us, and Schools Plus, the youth health centers, adolescent outreach services, they're all things that, the Office of Addictions and Mental Health work closely with Bethany and her team and the NSH on, and very, very important to us, and will continue to be as we work through community wellness, looking at universal mental health coverage and the continuum of services, because we know if we can provide more of those services easily accessible to our younger people, then hopefully we can keep them well, and then we don't get them into a situation when they are then unfortunately the people that you spoke about, their parents and things, right, where we have those issues. So very important programs to us. Thank you for raising it, and I can say they won't be going anywhere for sure.
Sorry.
Go ahead, Jeannine.
So I think one of the things that we need to look at as Nova Scotians is we have in most of our communities legions, rec centers, and we need to put like a nurse practitioner, a registered nurse, a dietitian, a physio, and let our seniors go there so that they get nutrition. Talk about to a dietitian because like their nutritional needs are not being met. Get their sugars checked, get their blood work done, have their blood pressure taken, play cards, give them a sandwich and tea, and get them out of their houses for at least a day. And because lots of our seniors, they think once they become over 85 that they don't have to move as much anymore. And they can't move as much. But to have a physio there to show them how to move appropriately and safely and how to. So I think we really need to start having community wellness start with our seniors if we have to, and then maybe go with our youth for mental health. But we have the facilities in all there's no reason for our seniors to go to the hospital to get blood work done and sit there with everybody else that's breathing on them. They should be able to go to to the Legion or wherever and have that done and get their flu shot and get their COVID shot and get all of that done so that we're not tying up all our pharmacists.
Love it. Absolutely love it. And if you saw the demographics, and I'm sure a lot of folks in the room will know our demographics, this is a province with an aging population, and the influx of people that we saw over the last 2 years are typically, generalization, but expats returning home, retiring. So, there's certainly a lot of young people as well, but the predominantly people are aging. So I think that's a fantastic suggestion. Thank you. What do you got, Nancy?
All right. The next question is around the cost of drugs. So cost of drugs for diabetics and IV therapy has been used for decades, yet costs keep going up. No-name brands are unavailable. They cannot afford to keep taking the inflation and cost of living. What is the government how is the government choosing to negotiate with drug companies for standard drugs?
So I'm going to put someone on the spot here a bit and see if Natalie might be willing to come up and speak to this one. This is
her wheelhouse.
I was going to say, did I have a choice?
Of course you do.
This is your wheelhouse.
This is Natalie Borden, folks, and she's the Senior Executive Director in the Department of Health, and the pharmacare programs are one of her areas of responsibility. So she is very well qualified to speak to this
Great.
answer.
Thanks so much, Jeannine. What we do here at the pharmacare programs is we actually are part of a pan-Canadian group that negotiates prices on pharmaceuticals. And the group is called the Pan-Canadian Pricing Association, which is the PCPA. And what they do is they work with all the provinces, or on behalf of all the provinces collectively, to negotiate prices for brand name drugs as they come to the market. So part of what they do is doing the initial negotiation with the manufacturers. Then that information, when that's completed, is passed on to the provinces, who then negotiate their own individual agreements based on those terms. The other thing that the PCPA does is they actually do also negotiate for prices of generic drugs. We know that sometimes in Canada, the prices of our generic drugs are not as comparable as they may be in some other places of the world. So that is also part of the PCPA mandate, is negotiating for those prices of the generic drugs as well. That process has been in place for a number of years, and the savings that are realized for each of the provinces who are part of the collective are pretty significant. So we're actually able to get much, much lower prices by using that organization to sort of harness the power of all the provinces together, rather than us having to negotiate one-on-one.
Thank you.
Yeah. Great.
Okay, thanks very
Thanks,
much.
Natalie. Thank you.
I'm going to take another question from my list here, if that's okay, and then go back out to the group. So this one is around a funding. So it's a client of a self-managed care program with the province. She receives partial funding toward the salary of a part-time personal care worker. And on paper, this sounds great. But there's also some issues similar to the transportation cooperative reality. It's not working well. It's become almost impossible to find a reliable person to come to my home for the $15 an hour the program limits me to. Many days I go without care. The government says it wants to keep people in their homes, but programs have cracks and someone needs to dig deeper. I've tried talking to my care coordinator within the department, but they change positions so frequently, I really remember their names before they leave for elsewhere. What's happening, essentially, is the question.
I'll take a stab at it, sure. That's, again, similar to a couple of the other questions. That's just so frustrating. It's frustrating when you call and nobody answers, and that's very typical of I hate to say it, but it is very typical of government that you would phone, you'll never get an answer. You'll get a voicemail. It drives me crazy. So now people mostly text just so you can get the person. So if you can get their number, then you can text, and they'll probably respond to that much more quickly. But that doesn't work, of course, for everyone. So the first, I'm not sure if the individual's here or not, but I'll share, and if not, we'll send this information out. But I think Tony's here. Isn't Tony here? Did I not meet Tony? Huh? Where are you, Tony? Wave. Are you hiding? Are you hiding back there? Do you actually want to answer the question then? If you're still here, there you are. Do you want to answer this? No, don't be shy. Like, you just say what you know, and I'll fill in around the edges. Say what you know, and because okay. You're the person. My note says if you're getting the runaround, call Tony.
Thank you. I actually was the self-managed care coordinator at one point in Colchester. I guess I'm surprised to hear that you're only getting funding for $15 an hour for the care. The program, I guess I would just like to talk to that person one-on-one, really, because the circumstances that they're in doesn't sound quite accurate, and we have other funding programs that may work better.
Okay, perfect. So we'll just an open invitation for that individual, and if they're not here, we'll follow up. So thank you, Tony. Thanks.
Perfect, thank you. Are there any other questions from, over here? Run, Rachel, run.
I have a couple of questions or maybe comments. The one that I'm just going to start from back to front is the youth mental health. Wondering if we couldn't be looking at vocational opportunities for kids in high school like we once did. We've got some needs here in the province for some skilled workers, giving these young people who are struggling an opportunity to get some hands-on skills instead of throwing them into academia and Never Land. Might be an opportunity for a win-win there. So that was just a comment or an observation.
Like it.
The second one is, it sounds to me like maybe we should have an ombudsman or an advocate or a navigator within Nova Scotia Health, because a lot of the questions that are coming to you are saying, no, that doesn't sound right. Oh, you need to speak to somebody. So it sounds like there should be somebody within the system itself to help navigate through some of this bureaucracy. Just an observation. And the third question I have is, would you consider adopting a traveling nurse or a doctor model in Nova Scotia to address some of the shortages and backlogs that we have in some of the particularly significant areas? So those are the three things that I brought forward.
Love them. 1, 2, 3. So 1, 100%, and conversations already in place, but got to get these guys moving a little faster. They don't all move at the same speed, so lighting the fire is important too. So I think that is an excellent point. In terms of the, I'm going to get Bethany to deal with the mental health, and then the third one. Look, you just threw me a softball. One of the things that would we consider a traveling nurse and or physician? So absolutely 100%, but we're going to do it with a little bit of a twist. So maybe you saw in the news at the time of the hurricane, I guess that was Fiona, not Katrina. Hurricane Fiona happened on the weekend, and one of the hardest areas hit was in Cape Breton. Northern zone as well. But in this particular situation, what we did, we had 2 people that were charged with gearing up a mobile bus. So geared it up, had 2 nurse practitioners and other members of a care team, including a Ukrainian physician and a number of other folks who were part of the team. Those 2 nurse practitioners, by the way, drove through the night to get to Cape Breton in time to be on that bus in the next day. Now, we put the bus at member 2. We had a very strategic, like we looked around, where's the best place, where are we going to get the most access? And the bus was down there for 6 days, and they saw on average between 40 and 45 patients a day. Some had doctors, some did not. We were able to give COVID information, COVID tests, we were able to do a whole bunch of different things. But I just want to share this story because I told the folks on Wednesday night, this is going to stay with me for a long time. And it proved to me how important this is. It's near the end of when they were finishing on the 6th day, a car drove up, and the car was kind of on its last legs. And in the car was a family, a young man and a young woman. They had an infant, and one of the grandmothers was in the back of the car. And they got out of the car, and the young woman said, I can't feed my baby. I'm not able to feed my baby. They're going to take my baby. Can you help us? That team, every single one of them, just wrapped their little arms around that family, and they set them up. They got a path for them. They did this, they did this, they did this. They did everything they could possibly do. And you know what? At the end, the whole health team, the nurse practitioners and all, said, this is what we went into. This is why we do our jobs. This is why we do our jobs. And then they say, Karen, anytime you want me on that bus, I will go on that bus. So, what are we doing with the bus? We're getting that bus on the road. And it's not quite the same as a traveling nurse or physician, but we are going to put it into underserved areas of the province, and we have the opportunity to put different kinds of care teams. So depending on the demographic and the needs of a particular community, we could do this, or we could do that, or we could do this, or we could do that. And the next best part of this story is it was a retired physician who put his hand up to help with this project. So I love every part of the story, and I would just say stay tuned and look for the bus. So I think Bethany wanted to deal with the mental health. Sorry, I was so busy with my story I forgot.
It was actually the ombudsman piece that I was going to speak to. So I just wanted to familiarize everyone with the fact that we have a patient relations service in Nova Scotia Health. So every zone has a phone number and an email where patients or families or members of the community, if they have a concern about a patient care or a case, can call in and speak to a patient relations representative. It's not someone directly related in the care itself. It's another person. And they review your concern, they document it, and then they will quickly connect that concern to the right team to investigate and connect back with the family member or the patient or the individual who's called in. We have a renewed focus on this with improved turnaround times for connecting back with people very quickly to make sure that their concern is, being vetted and heard and investigated. And then we also have, through that process, been able to bring a number of patients and families into our advisory groups. So we have patient and family advisors in Nova Scotia Health. They sit with us on planning committees. They advise us on new policies, for example. I think we had someone today who even expressed interest in joining our emergency department as a patient and family advisor here tonight. So if you're that person, thank you. And so we just really welcome that feedback as well. So it's not quite the same as an ombudsman, but it is really a way for you to reach out with your concern, and someone will follow it up definitely, and the team will get back to you.
So we're getting close to time. So I have one more question that I would like to ask. Is around the computer system. So when will the computer system be the same across the board, IWK to Cape Breton?
Can I just say stay tuned? Or
It's
do you want,
okay.
or do you need a longer answer?
No, we can say stay tuned.
But I mean it. Like, stay tuned. It's a very, very, very important question. And if we could give you the number that of the inefficiencies in our system caused by our outdated, obsolete, 3,000 different programs, like, for example, an ER doc has to go through like 8 programs, literally, password and everything, to get all of the information pertaining to a patient. And I know this because I had the ER doctor take me through it and time it. So it's high on the list. Stay tuned.
I like that short answer. Actually, that's excellent. Yeah, as someone who works in the
Telling me I
system,
talk
I
too
also
much?
no. I'm just saying I like that answer. That it's that's good. Yeah. So I think that really does take us toward the end. We don't really have a lot of other written questions. Does anyone else have any burning? Oh gosh, we've got a couple still. Okay. Thank you.
I just wanted to follow up with Janet's comments in regards to utilizing our legions and our community centers and our church basements and all of these things that we already have full access to in our communities. Our communities are bled dry of volunteers. Everyone is working, everyone is strapped. The world is short-staffed, our volunteers are short-staffed. So as the president of our community center in Londonderry, we apply annually for the grants through the community health boards, which ours is the Along the Shore Community Health Board. And getting those funds is absolutely paramount in being able to offer the programming that we're able to do. However, there's 3 of us that do it. I'm tired. So if you folks could come up with some type of system that puts, members of public health or those nurse practitioners or blood draws or any of those things, we have the space, call us, you can absolutely 100% do that. So I just wanted to comment on that because I wasn't sure I'd catch Janet on her way out. So thank you.
Thank you.
Good points. Thank you. Thanks.
I think there was one more question in the back. Final question. No pressure.
I'm not under any pressure. I did submit a question, and I'm hoping it was already answered. It was around outcome measurement of the care that's being provided in primary care by primary care physicians or others. So I'll leave that one. But my other question is around 30 years ago, we were talking about these same topics. You can go back to the Truro Daily News, and you can read, there were primary care providers missing. We don't have enough of them, whether that be physicians or whether that be nurses, whether that be physiotherapists. It didn't matter. There wasn't enough available for the community at that time, and there was a perceived not being enough available to grow as time went on. Well, that's self-fulfilling. We see it happening now. Collaborative care practices were discussed more than 30 years ago across Canada. They were in place 30 years ago across Canada, but Nova Scotia was really slow to the mark in getting those put in place. Our Nova Scotia taxpayers pay a significant amount of physician medical school costs, and I'm sure we probably pay more for other healthcare providers. How do we get that back? What are we going to do differently in the province this time so that in 30 years' time, when I'm going to be really in need of a lot of care, that we're going to have a sustainable system here in Nova Scotia?
Like, you could be sitting at our table any day of the week because this is a constant question. So we'll give you a few thoughts and then conclude. So do you want to start or do you want me to? Okay. I mean, look, I have been there since September 1. 2021, so I can't comment on, I really can't comment on what went before. Jeannine can, but I can't. But I will tell you, all kidding aside, this government is so focused on health and all things health. I mentioned earlier receiving more dollars. That's, one way of showing government support to all of the initiatives. We have not, the only thing we are limited by, Jeannine and myself, in supporting and directing our teams, we are limited only by our imaginations. We don't have anybody standing in front of us saying, you can't do this, you can't do this, you can't do this. That is, we do not have that. That has happened in the past where people have, put up their hand with a good idea, and for whatever reason, it just hasn't come to fruition. So we don't have that. Nobody's saying that to us. So when I say limited by our imaginations, I mean it. And that's why we like to do this, because we only get 2 heads, and 20 heads are better than 2. So I would share that with you, and then I want to talk a little bit about accountability, and can we talk about, well, you can talk about what we're doing with respect to physician accountability. I don't know. Yeah, sure. Why don't you share that? Your point on the medical school and the tax dollars, it's definitely not lost on us, and we do know because we measure and look at productivity. So we know where we can make up for some lost productivity. So I don't know how you want to frame that, Jeannine. I'm not trying to put you on the spot, and I'll talk about it if, yeah.
Yeah, no, and we've got a couple of projects that are on the go right now, looking at exactly that, right? And when we were talking about, for instance, how many patients does a practitioner have? How many, if they're on a contract, how many hours are they don't bill directly, but we call it shadow billing. We're just going through the whole accountability process, because we know that there are a lot of people a lot of practitioners that are out there, and we're just trying to figure out how we can get more people attached to them. So we're looking at all of the different productivity measures that are out there. The other thing that I would just like to say on your comment of kind of, why now? I mean, how is it going to happen now when it hasn't happened before? And I think that part of it is how we are working. And I think as Karen said, we work together. There's a health leadership team. There's the 2 of us. There's the administrator of the Nova Scotia Health Authority, Janet Davidson, and Dr. Kevin Orrell. And we come together literally every week, once a week for an entire afternoon to talk about the issues of the system, to look at new ways of doing things, to hear how we can advance things, to make things go faster. So what I would say is the system is working differently, and we are working together in a way like I have never seen before. And that, I think, is going to help us to get to where we need to get to.
Thanks, Jeannine. I just have a parting example for you. So as a result of this health leadership team, we wanted to take a look at the Dalhousie Family Medicine Clinic and make sure that it was being as productive as it could in seeing patients and putting residents through and so forth. So we chose that one only because we have some skin in the game there. So we have the ability to do some things. So we put a team in with the agreement of the clinic and Dalhousie. The team went in for 4 days. They went in Thursday, Friday, Saturday, Sunday. By Friday night, my team lead called and said, Karen, we found some efficiencies here. We think we can take 2,500 people off the list. And we got 2 more days to go. So they finished, and as a result of what they looked at, and I'll tell you in a minute, they were very comfortable that they could take 3,500 people off the list. The project started 4 months ago. They have 3,500 people off the list. The trick, and what we determined, because the team went through, what's everybody doing in this clinic? What are they doing? And what they found was that the wrong people were doing the wrong things. So they had physicians doing a lot of admin, and they had admin doing different kinds of admin. So we put a team together that we call it our rapid onboarding team. So it's a team of 3 people, and they are doing the initial workup of a potential new patient for that clinic. So the person's not coming directly to the doctor to take whatever period of time. It usually takes between 60 and 90 minutes to do the initial, who are you? Tell me your history. So we have that's happening by a team, and that team is going to be available to go into any office in this province. I use the Dal Family Medicine Clinic as the starting point, but the team will be available to help any doctor, any physician, any nurse practitioner for that matter, to onboard patients more rapidly. So that was one thing. There were numerous others, but I'm conscious at the time, and I do talk a lot, so I could go on. But your point's so bang on, and it's one we ask ourselves very regularly, and try to find ways that we can help our providers so that we have the right people doing the right things to maximize what they want to do, which is see patients.
Why do we have well-trained, educated, highly educated practitioners giving flu shots when they could be seeing primary care patients that need so much more care, where we have lots of others that actually can provide it? Janet mentioned nurses and LPNs, but and I know it's a big change, but I really think it's not just that one example. There are lots of other examples where the right provider is not providing the right care at an expensive cost.
100%. 100%. And, getting the right person doing the right thing. I mean, I hate to use the M word, money, but, and I'm not talking about what we pay. I'm talking about, anyway, I won't get into it. But it's part of the equation for sure.
Yeah, thank you for that. And and it is, we realize it's now 9:00 on a Friday night, and I want to say on behalf of everyone here, thank you for coming and for your participation. And I said it on Wednesday, I'm saying it again. I think it takes tremendous courage for people to come up and ask the questions that are hard questions and ask them. And I also think it takes courage to stand in front of a group of people and answer those questions. So I think that it is the community that comes together that will hopefully come up with the solutions that we need in healthcare. And we're very, very grateful, and thank you for participating. And as I said, this is being recorded, and will be a link will be available to those of you that have registered. So thank you very much again, and safe travels home.